Welcome back to Therapy Matters. We are excited that you decided to take a look at our page. I have Colleen Todd here, and she is going to answer some questions for us. The thing that I really want to know is when you have clients come in, what is it that you wish they knew about going into a therapy experience?
I suppose it depends on the client. I think there are experienced clients and inexperienced clients, so people that have seen therapists before, some that haven't. I think what I'd want folks that haven't seen a therapist before to know is that it's a comfortable place, that it's not this scary, judgmental zone, or it shouldn't be. It's a place where you're just having a conversation with somebody, and that somebody knows how to keep the session moving, that it's not going to be you that's responsible for figuring out enough to say or figuring out how you want to approach therapy yourself. It's the therapist knows how to work with this. The therapist is very comfortable with first sessions. And so I think the thing I would want a client to know most is just that they're going to feel comfortable and that they don't have to worry about the components of therapy, that the therapist themselves is used to this process and is very comfortable with it. So yeah, I think that's one thing I want.
So that's the first kind, the kind of the clients who've never done. So those are clients who would be a first time in a first session. They haven't had any. Here we go.
Good.
So that's for your first time clients who haven't seen other therapists before, and they're just trying this for the first time. How about people who have maybe had previous experience with another therapist or with several therapists, and they've done this therapy thing before, and they kind of know what they're in for?
Yeah. I think there's a lot of things one needs to think about when they've had several therapists before and they're trying a new therapist. One thing I think is helpful for folks to look at is what has been their pattern in therapy previously. And thinking about, these are questions I typically ask when I'm first meeting with somebody that's had several therapists before, what were the patterns there? What worked? What didn't work? And that we can approach the things that weren't working, or we can look at those and see. I think that's a lot about fit, whether a therapist fits your style or not is figuring out what you previously didn't like or liked about therapy, and seeing if this therapist can be straightforward and honest about what they offer and whether or not that's a match for what you're looking for. So I think in general, when going in, it's not exactly the question asked is what would I want them to know, but more so I'd want them to find for themselves is what worked, what didn't work, why, and then feeling out with a new therapist whether or not it feels like a fit, it feels comfortable, if it feels like this therapist has the skills to meet the needs that you might have, and if the therapist has the traits that have not worked for you in the past, and looking at that. Now, it's not always easy to tell. Everybody's got a little bit of most traits.
Right.
But if it was really not working to have a very active therapist or a very passive therapist in the room before, looking at that and seeing who you're sitting in front of and what you're going to be getting out of that.
So would you even recommend the client potentially coming in with a laundry list of I think I liked this, I think I didn't like that, I don't think this helped me? Is that something that is beneficial, just self-reflection before they come, or is that something that happens more in the session?
So it depends on who you're in session with, and here at Therapy Matters, that's a part of our intake. Our goal is to find out what you see a therapist as. Those questions happen before you even meet somebody, because it's so critical to us to know that people feel like it's a good fit, that it's a match, and that they're going to feel comfortable, and they get to name what traits they like in therapists and what they don't. And so we're constantly reviewing for that. So the list forms with that. Wouldn't hurt for somebody to come in with a list of things that worked or didn't work. If you're not seeing a therapist at Therapy Matters, then it might be good to consider those things. I think the things we look for, and the things that are in our intake is, do you see a therapist as a an advocate? Do you see a therapist as a truth sayer? Do you see a therapist as purely supportive, or a mix of somebody that is active in session or listens more and is just kind of taking in a wide range of issues that you might need to talk about and express at a certain time. And I think we're a mix of all of those things, but that gets to get stated there. Also, our questions, in our intake is, what's worked for you about therapy? What hasn't worked for you about therapy? How do you see the ending of therapy? How do you see the beginning of therapy? And so, and I think for people that are coming in for the first time, they're not really sure about all of those things, but more experienced clients will be more aware of that. I think for less experienced clients, it's still important to answer those questions so that if there's images you hold from, let's say, a Hollywood or some sense of how you've seen therapy, or everybody's had some I shouldn't say everybody, but most people have had some exposure to like watching a therapy scene on TV, right. And what did that tell you? And so a lot of times we can do away with some myths about therapy in that way too, because a lot of times on TV you'll see this clipboard therapist, and we do have clipboards.
Tell me about your mother.
Yeah, and so, but it's not that like, well, I don't know, maybe some people are, but I think we strive to make people feel comfortable and at ease, and then we can step into the issues and difficulties that somebody might be having from there.
Do you ever have clients who come in with questions about maybe why they've had to have so many therapists, and they're just kind of like, I don't think therapy works for me? Yeah,
so I think a lot of times it's like any of us, like if we see an interaction we've had with a friend or a family member regularly, it's worth taking a look at what's happening. And it's not saying that when we look at this from the client perspective that the client's at fault in any way with that, but there's a dynamic that's most likely happening there if it's on repeat, right? If that keeps coming up, and it's really discouraging and leaves people feeling hopeless and as though there is no course forward for growth. And I definitely don't feel that that's the case. I've worked with folks that have had trouble with previous therapists, and we do have to talk about, why do we end therapy? Like, what do we need to work on? If we get to a place where it feels like you don't want to come back, let's talk about what that is. Let's see if we can bust through that that barrier that might be difficult or confusing for many clients. And usually at the minimum, folks will learn a lot in that process, even if they do decide to move to another therapist. And then the other thing is just looking at patterns like, do we switch therapists when the work is starting to get tough and it's really hard to stay present with your therapist? Because, for a lot of people, the reason why it gets really hard to do therapy is they get mired down in shame, right? They think that they have to feel horribly about themselves when they view their, what we call shadow parts, the parts of us that nobody likes to admit that they have, but everybody has, and everybody thinks their shadow parts are worse than everybody else's shadow parts, and it's not true. We all have shadow parts. We all have things that, we're not entirely proud of. And so, and there's no reason to be ashamed of that. Like, it's human behavior. If you weren't behaving that way, like if you're human and you're behaving that way, it's human behavior. Right. And so, so I think that a lot of times is something that will cause people to want to switch therapists, especially if the therapist is in any way shaming, right? Hopefully nobody's having that experience, but I'm not ignorant. I know some folks have had that experience.
And maybe it's not even something intentional the therapist did. No. It's just something that that is exactly what my mother used to say.
Yeah, it can be. There's a wide range of things that can create that. It also can get projected onto the therapist that they're judging, whereas the therapist is not. And, you know, sometimes there's therapists that haven't had as many experiences as other therapists. And I think things that get said in therapy aren't the things that get said, you know, out in public all the time.
Yeah.
And so, so it really depends on, you know, basically sometimes if a therapist seems surprised, right? If they're surprised at a behavior, like that can be really shaming, right? It's like, oh my God, I'm really messed up. If she doesn't like,
she's never seen this.
oh my God, like this is a professional who's seen hundreds of people, thousands of people. And here I am surprising her. I must really be off the chart. And that's so not true, you know? And there's, everybody's got their thing. Nobody's shadow part is worse than anybody else's.
Yeah.